OCD. In America, 3.3 million people have OCD, and to them it can often be a very crucial part of their reality. But what do you really know about OCD? What is OCD? OCD, or obsessive-compulsive disorder, is a disorder in which a person has obsessions and/or compulsions that they feel they should follow for reasons that don't always seem rational. What are obsessions? Obsessions are repeated and unwanted thoughts, urges, or images that are unavoidable and can cause distress or anxiety. And they are one of the things that a person with OCD must deal with in their everyday life. OCD is different for everyone, but here are some common examples of obsessions. An excessive fear of contamination or dirt. A need for things to be orderly and/or symmetrical. Aggressive or horrific thoughts of harming yourself or others. Or unwanted thoughts, including aggression or sexual or religious subjects. What are compulsions? Compulsions are repeated behaviors or rituals that a person feels like they have to do, even if they can't fully explain it. This can help calm the person down when they are having their obsessive thoughts. Some common examples of compulsions can include excessive washing or cleaning, performing multiple checks on the same thing over and over again, counting something repeatedly, being excessively organized, setting a strict routine for themselves and then following it closely, and a constant need for reassurance from those around them. What are the causes of OCD? What causes OCD hasn't entirely been figured out, but there are a few ideas. Biology. Changes in the body's chemistry or brain function may be causes. Genetics. There may be a genetic component, but exactly what gene is causing it has yet to be figured out. However, it can be said that people directly related to someone with OCD are about 5 times more likely to have it as well. Environment. There may be some things in an environment that can trigger OCD. Who has OCD? Around 2.3% of the population has OCD. A half of the people with OCD develop it in their childhood. OCD is unlikely to develop in those over the age of 35. Among adults, men and women are often equally affected by OCD. Treatments. Less than 10% of people with OCD actually seek treatment. But if you have OCD, it is important to know that help is out there and available and that you are not alone. 2 of the major forms of treatment include psychotherapy and medication. What would psychotherapy include? Psychotherapy would most likely consist of ERP, or exposure and response prevention. This involves gradually exposing yourselves to the things that trigger your OCD in order to eventually be able to manage them better. Medication. There is no official OCD medication. However, antidepressants often are used to treat it. Conclusion. OCD affects a lot of people in our world and has a definite hold over many people's lives, but learning about it can help you understand what is going on and can make living with OCD a lot easier.